Hi there and welcome to Startup Central. I'm Nayantara working from home. This is the only show of its kind on Indian television dedicated to startups, of course, technology, innovation, disruption, entrepreneurship. If it falls under the gambit of the new economy, it's here every weekday on ET Now at 6 p.m. Ladies and gentlemen, like all the stakeholders that we feature on the show, Team Startup Central thrives on constructive criticism. We can handle it, we can take it, so keep writing into us. Tell us how we can improve the show, what we should have on the show, what we should never have on the show, what's missing. Our email address right on top, suc@etnow.tv. I'm also on Twitter. You can reach out to me directly. Right, so over the weekend, on Independence Day, like we've been telling you here on ET Now, the National Digital Health Mission became live. It was announced by the Prime Minister himself from Red Fort. So the National Digital Health System is being considered a game changer, maybe even a UPI moment for the healthcare sector at large. The idea is to create a digital ecosystem where, for now at least, it is voluntary for Indians to sign on and get unique health IDs. If you go on the website, it promises that you can even get multiple unique health IDs. To put it simply, I'm Nayantara Rai. I can go on a mobile app, the website, and get one health ID for, let's say, if I have gastro problems. I can get another health ID if, let's say, God forbid I don't, but I break a leg. They do, however, recommend that you should have one health ID so that everything is consolidated in one place. Then, for the first time ever, what is being attempted is a repository of qualified doctors and healthcare professionals who must be recognized by the State Medical Council or the National Medical Council. So in a nutshell, it basically means, those horror stories we've all heard of, gone through ourselves, or our family members have gone through, friends, colleagues, we all know those people who've gone to see doctors who didn't turn out to be doctors. The third leg, and that's of course to tie in the healthcare facilities, hospitals, clinics, all of that, they will also be registered. Now the registration, the benefits for the doctors, they'll be called digi-doctors, is that they can then be part of the digital ecosystem. They can prescribe online, they can diagnose patients online, they can even write discharge summaries online. So to be a part of the digital ecosystem, the doctors have the option to volunteer and sign on. We did interview the person who's going to be executing all this, Dr. Indu Bhushan. We'll play you an edited excerpt later on the show. But for now, I'm going to go across to two gentlemen. These two gentlemen are part of a new ecosystem being called Swasth. Now, Swasth seems to be offering and will be one of India's first 360-degree digital health service app. It's literally got the who's who of the healthcare, technology and investor community. So joining me to talk more about this health tech, the National Digital Health Mission, is the CEO of Medanta, Pankaj Sahni. I'm also being joined by the co-founder of CureFit, Mukesh Bansal. Thanks, gentlemen, for joining us here on this edition of Startup Central. So I went on the website of Swasth, and like I said, it's literally got the who's who of healthcare community, the investor community and the technology community. Pankaj, you're there from the medical fraternity, CEO Medanta, but you've also got your other industry peers, whether it's Dr. Ranjan Pai or Shobna Kamni from Apollo. Mukesh, there are other technocrats there as well. So if I can come to you first, Pankaj, how did this happen? How did all of you get together in one platform, talk about a digital offering?
Well, I think that the biggest thing that kind of pulled us all together was the overarching vision that everybody has, that we need to actually change the way healthcare is looked at, perceived, delivered in the country. So there's a lot of talk that has been happening around this for some time across providers, across health tech players. And really, we've been actually waiting for this kind of a spark to put us all together, and COVID really was that spark. So a lot of people came together to wanted to understand that what can we do, putting aside whatever competitive pressures that may be there that they had in the past, and really working together in a true spirit of partnership to actually create something that could help serve the nation, help serve the people, address this current challenge that we have with COVID. And I have to say, and Mukesh can speak to this because he's really been, the passionate person driving this. There have been 4 or 5 people along with Mukesh who've been the glue that have kind of held all of this together. But to get such a large group of people on a same platform with the kind of motivation to work, remember, everybody has been doing all of this work completely as a non-profit in extra time. So they all have day jobs. This is kind of an extra effort. And in a period of a short few weeks, we've been able to get apps up and running, get consultations done, help thousands and thousands of patients across the country. It's been a monumental effort, and I think everybody has really done it in the true spirit. That's really the best part of this.
So let me just take our viewers through all the people who have been involved in this. And I'm going to ask the producer to get those graphics up as well. You've got Chris Gopal Krishnan, Nachiket Moore, Dr. Ranjan Pai, Sharad Sharma from iSpirit, Shobna Kamni from Apollo, and you've got Axel also on board. So that's the governing council. Then Swasth has something called a core project team, which has Mukesh Bansal, who's I'm coming to next, Prashant Tandon of 1MG. It's got the founder from Practo, Call Health. You've got Policy Bazaar, Medanta Pankaj joining us from that, and Columbia Asia. So Mukesh, you've seen how Pankaj is giving a lot of the credit. I'm guessing you are one of the brains behind the app, the way it's going to look, the way it's been designed. Is this really going to be the first full service digital offering for health when it comes to India?
And let me start by just acknowledging actually there are a huge set of people, as Pankaj mentioned, who are behind this. From day one, many of us, from the health tech industry, healthcare industry, we came together. Our initial goal was how can we put all of our energies together to be relevant in the COVID timeframe. And we felt if we can put together open source free app, which can service all the basic COVID use cases, whether it's telemedicine, getting testing done, finding hospital bed availability, mental health issues, etc. And a lot of companies contributed their code as a free open source. Most of the work for Swasth starts at 6 p.m. and continues till very late in the evening. It's been just a phenomenal teamwork and extremely humbling to see the dedication and passion from a large group of people. I must also acknowledge a generous contribution from ACT grants. They gave us our initial funding. There have been a lot of ongoing dialogue with various government agencies from day one. So we've got a lot of useful input. And as we started making progress with COVID, we got more and more involved with the National Digital Health Mission. We are actively in collaboration with various groups which are contributing to NDHM. We have shared our point of view. And now we realize that as this coalition of large group of players who have, as you mentioned, covers the end-to-end spectrum of entire healthcare ecosystem in India, we can also play a pivotal role in helping accelerate the implementation of NDHM. So, this opportunity to make a large-scale impact on the digitization of healthcare, in some ways, take the Indian healthcare system to future, which will not only make universal patient healthcare easily possible, but also unleash next wave of innovations. As you mentioned, it can very well be the UPI moment for the healthcare industry, and we are all super energized by that possibility.
Okay, so it can be the UPI moment for the healthcare ecosystem. But Pankaj, as you would know very well as a CEO of a large hospital chain, health is a state subject, and that is something that all healthcare providers have to battle it out. So unlike payments, this is certainly going to be a big problem I would imagine, when it would come to the digital ecosystem. If not a problem, at least something that needs to be worked around.
So you're right, Nayantara, health is a state subject. But you see, I think the most fundamental thing is that all healthcare, at least all healthcare delivery, requires a patient who is in need of assistance, need of care, and a healthcare provider, whether it is a doctor or a physiotherapist or a hospital, that can actually assist that patient to get the care that they need and get the support that they need. And what we have found, not only in India but globally, is that increasingly with the advent of various types of technology, whether it is telemedicine, whether it is at-home diagnostics, whether it is wearable devices, a lot of care is actually now moving out of big systems like hospitals and clinics and can actually be delivered in a setting that is much closer to where the patient is. So digital is here, telemedicine is here, remote care is here. And I think actually, if you think about it, maybe the technology was here earlier. It is now actually the coming together, the mindset shift, both from patients as well as from doctors, from the entire ecosystem, to actually say that, this is a pivotal moment. I mean, we are really at a tipping point in the way in which healthcare can be delivered. And COVID has frankly exposed us to this. So some of it was that by force, with the lockdown, patients couldn't visit hospitals, couldn't visit their doctors. So they were forced to move towards telemedicine. I mean, we've been talking about this for some time, saying that, it is something that really we should be looking at. There are just not enough hospitals, not enough doctors to service India. We have to look at digital. We have to look at innovation. We have an amazing startup ecosystem. We need to get all of these players on board. And this kind of a platform actually allows for people to innovate. You will have innovation coming from the payment side. You will have innovation coming from the delivery side. You will have innovation coming from the diagnostic side. So I think that the fact that we need to work around things like, state subject or national subject or new regulations, these are things which are manageable. These are things which we have to get through. And what's really impressive is to see the various agencies of the government has actually been very proactive, very forward-looking, whether it is the NHA, whether it is Niti Aayog, going up to the highest levels of government. There is a very, very strong support to say that this should get done. And the fact that it is now on the national agenda, I think, is excellent. In fact, it's about time, and we should not lose this opportunity. So I personally think, whether it's states, whether it's the center, whether it's districts, whatever it is, public or private, this is the chance for us to make a very big difference in India and leapfrog what the rest of the world has done.
Great. We have no choice. We have to innovate. We have to leapfrog. And I think if COVID did force us, was to preempt a lot of the things that should have been in place earlier, like maybe telemedicine or even the entire plight of the e-pharma companies. Mukesh Bansal, if I could come to you now, give us a sense of what's on the cards. I understand now that the health ID will be unique, it's going to be voluntary, doctors will be onboarded, at a later stage insurance companies will be onboarded along with e-pharmacy companies. But what is it looking like, and how far are we from that all happening? I would imagine that, just given the population of the country, is going to be a monumental task to just make sure that those who want it get a unique health ID.
Right. So, Nayantara, the good thing is a lot of work has already happened, so even though the announcement, is made today, and this coalition has come together last 3-4 months, but there are various, groups who have been working on it for last many years. Many people in the government, from Ministry of Health, Niti, NHA onwards, have been working on, a documentation and definition of NDHM. It has gone through many iterations over last many years. So it's a quite deeply fleshed out document which lays out all the standards and protocols. It has been thoroughly vetted by the industry. A lot of industry input has been factored in. So from definition point of view, pretty much everything is ready. Some components are already implemented. I think the coming months and quarters, we need to make sure there are a lot of building blocks. Some you have mentioned, things like a doctor registry and distribute patient health ID and consent managers, gateways, which do routing of transactions between various health service providers, creating registry of various types of provider within healthcare ecosystem. So a lot of components need to be built. Many are being built by government themselves. Some are done with the private-public partnership. Swasth is going to play its role. Beyond that, then all of us in the health ecosystem need to plug into that gateway. Much like UPI, you may have a central interface, but unless all the banks integrate with that and allow for seamless interoperability, it's not going to be useful. So I think all of that, may take 6 months to a year before all the systems are interoperable. But eventually, it will make patient life super easy. I'll be at the click of a button, I'll be able to talk to doctor from any of the service provider from any interface. So you can imagine how much healthcare access will be democratized. As a result, I'll have access to all my health records, no matter which hospital I go to, using my one ID or multiple ID. I as a patient is fully in control of my health data. No doctor or hospital will own my data. But whenever a need arises, when I'm sick, I'll be able to give permission, and the doctor or hospital will be able to pull up all my records and create a comprehensive picture It'll make it much easier to get access to health insurance, any payment mechanism that are available, and one click you can get immediate approval. So a lot of things will become possible, as this health data accumulates, and there is seamless democratic access to all this healthcare service. New players will emerge. A lot of startups will be able to innovate on top of this entire ecosystem very rapidly, as opposed to building things slowly or many years, and trying to go through a lot of red tape. So I think it's very, very progressive step, Nayantara, and I think patients will see real impact in their day-to-day healthcare usage in short to medium time frame, and long term we'll see some dramatic innovations coming out of this.
Pankaj and Mukesh, I wanted to hang in there. I want to just play two short bites of Dr. Indu Bhushan, the CEO of the National Health Authority. He, of course, was also the one who had rolled out Ayushman Bharat. This is what he told us in an interview just a short while back. Just listen to it, then I'm coming back with some questions for you both.
In this mission, trying to develop that backbone or infrastructure where we'll have unique health IDs, we'll have IDs for all hospitals, we'll have all the electronic medical records, the standards for those all electronic medical records. And once this backbone is complete, we are expecting that a lot of private sector innovation and creativity will come in terms of preparing or developing apps which can provide different kind of services. For example, hospital management information system in terms of providing or tracking what is happening in the hospital. And that HMIS, Hospital Management Information System, can ride on this platform that we have created, and there will be a different kind of HMIS coming up. Similarly, for labs, those kind of software will come up. For doctors to provide services, clinical decision support systems will come up using our platform. For people to identify or find which are the good doctors close by, which are the good hospitals close by, those apps can come up, because apps can use and help or take data from us, and the publicly available data, and provide that kind of service. And we are going to be launching in a couple of days what we call a sandbox. And the sandbox is like experimental space where these developers can come and try to see what the system is and try to integrate their own apps and see how they can build this infrastructure.
Okay, so in the days to come, we will see a sandbox regulations coming out. We'll have some API based on which other innovations can also take place. Pankaj Sahni, if I can come to you. Now, during the course of this interview, what Dr. Indu Bhushan also told me is they're going to follow what he's describing as a federated structure, which basically means I, as a patient, Nayantara Rai, let's say goes to Medanta, has some diagnosis, some lab report, some radiology report, etc., etc. I can choose whether I'm going to keep that data with me, on my smartphone, iPad, or I give the hospital permission to keep that data. The big question I want to also ask you is that you already have so many people's medical records. What happens going forward? I would imagine, if Medanta, Apollo, Max, Fortis, etc., decide to onboard and become a part of the digital ecosystem, what's going to happen to all the medical records that already exist? And is it really feasible to say that, okay, I'll only keep the digital records, the hospital will not keep the digital records?
So I think, Nayantara, the most important thing to remember is the intent behind how this thing has been structured. And the most important intent behind this is that you as the patient are the owner and custodian of your health information, nobody else. And that is the intent behind which this entire thought process has been stitched together. And by the way, this is not even true in many of the countries of the world where you cannot actually access your health record because either the hospital or the HIS system, which is employed in the IT of that hospital, doesn't allow you to access the record. So I think the concept that the patient owns their own health record is 100% correct and is the way in which we should be building this up. Now, what this means is it's not so much about whether you will be able to access the information which is from one hospital, but what if you actually are seeing a cardiologist at Medanta, you are seeing a gastroenterologist at another hospital, and you happen to be on vacation somewhere and had an injury and an orthopedic doctor needed to treat you in that hospital. Now you as the patient will be able to access all of this information and you will be able to provide with a consent mechanism your doctor in the relevant institution where you're being treated with the information that you choose to provide. So you will be able to give consent and permission for your doctor to actually look at your data across all of your history over years so that the doctor has the best possible information to be able to treat you. Today, what we have is that one institution keeps their data locked into their IT systems, another institution keeps their data locked into their IT systems, and you'll often see patients are actually walking around with bags with physical files and X-ray images and paper prescriptions. All that will go away, and the patient will have access through a digital mechanism to their data and be able to provide that to any physician that they so choose, so that they'll be able to get all of the correct treatment. How we actually work out the nitty-gritties as to which database this will be stored in, what will be the IT mechanisms and the handshake mechanisms for this data to be transferred, these are details which will get worked out. The core intent behind this, that the patient owns their own data, is, I think, what is the most important, and in my opinion, that is absolutely the right way to move.
Okay, so Mukesh Bansal, if I can come to you, and this is something else I wanted to ask you about. The very fact that for the first time ever, we are attempting a database or a repository of sorts, pan-India. It might be for the digital ecosystem, but it's going to exist, of doctors that are actually qualified, recognized, have gone to medical schools, of healthcare facilities which will be above a certain mark for them to be a part of the digital ecosystem. For me, that is also extremely important and something we don't talk enough about. There are enough horror stories of malpractices and all of that.
Yeah, absolutely, Nayantara. I think there are numerous benefits from this DigiDoctor registry that is part of NDHM. So as you rightly pointed out, from patient point of view, when I log into any of the, let's say, telemedicine app, which are powered by NDHM, all of them will be accessing this central doctor registry, which ensures that all the doctors have already been verified. And as a patient, I'll not have to worry about that the person at the other end of telemedicine is a qualified professional or not. On top of that, there's going to be a lot of ongoing quality management, audit mechanism in place. So not only the registry is up to date on day one, but it will also be maintained and corrected on an ongoing basis. So that's great for patient. But if I'm a doctor, let's say, I'm a lot of doctors, they go to smaller towns, they're highly qualified professional, but because of that's their native city or out of their passion. But sometimes, they don't have enough work there. Today, by registering into one or multiple telemedicine or hospital apps, they will have access to patients across country, which means, none of the doctor will be unutilized. We have seen when a pandemic happens, suddenly there's a rush of patients in a particular city and a physical space. You are bottlenecked by number of doctors there. But with a telemedicine infrastructure, you can connect doctor supply wherever it exists to patient wherever the demand may be. And we've seen, as the flu season, even without COVID, it happens at different times in different parts of the country. So you can have much better load balancing. You may have a specialist, who may be available in big towns, and someone from a small town, beyond GP, they don't have to travel hundreds of kilometers just for a 5-minute, 10-minute appointment. They can get it done through telemedicine interface. So it's a really digital infrastructure, which will increase efficiency in the system, increase value for the customer, increase value for the doctors, and just overall, help make the system a lot more transparent, cost-effective, and high quality for everyone involved.
And Pankaj, do you imagine that it'll be a high entry cost for this? I mean, I understand the fact that it'll be free of charge to get a digital unique ID, but the very fact that you have to be savvy enough to get the ID, you have to be savvy enough to be able to go to a hospital chain or a doctor or a clinic who's going to help you out, because let's not forget, we often forget about the patients that don't live in urban centers, who don't have access to education.
You're right to some extent, Nayantara, but let's not underestimate the intelligence of our population. We have a huge population already that is fairly digitally savvy, more mobile phones than any other country, a huge penetration with internet now, 4G and upcoming technologies actually penetrating deep into parts of India that didn't exist many years ago. So I think that we will have a population that will actually be fairly digitally savvy. And also there is a lot of support systems that set up. So there are these common service centers set up by the government in villages, which can be actually doing assisted teleconsultations. If you take just even our own experiences, sometimes maybe with an elder or with a grandparent, we are often teaching them, assisting them on smartphones. But from a 2-year-old to a 80-year-old, now people are getting very savvy using technology, and that will actually be what the innovation will stimulate. So people who have easy user interfaces, simplicity in actually getting access, these are the people that will be the winners. So I think the opportunity is not only for increasing access, but also for innovating around the patient journey, the patient experience will actually be key. And this is exactly what the idea of creating a platform is, rather than just delivering one product and saying, use this, which may or may not be the best product. The idea was to create a platform and let everybody innovate around this, and let the best company or best organization, so to speak, win. So I think that this is the way in which we actually need to move forward, to create this open system, let everybody plug in. There is far too many patients in India, not enough healthcare facilities, not enough doctors. This is the need of the hour. This is the right way to move.
Yeah. Yeah, in fact, once it becomes remote, as we've all learned during COVID-19 and telemedicine, you can actually reach patients from urban centers and diagnose them, treat them, link up with pharmacies. There have been some fantastic stories that we've been featuring right here on Startup Central. We've all been reading about them in national publications as well. Gentlemen, I'm completely out of time. I'd like to thank both of you for being so frank and candid and joining us here on the immense opportunities that actually exist. I guess it's time now for the likes of both of you to get cracking and come out with it. And of course, the National Health Authority is also promising sandbox regulations between 2 to 3 days.